Today, we're mastering medications affecting the urinary tract and bladder. By the end of this video, you'll know drugs for urinary tract infections, antispasmodics, urinary analgesics, and bladder protectants. And as always, after every drug and at the end of the video, I'll challenge you with an NCLEX question. Urinary tract infections are common. Remember classic symptoms: pain, frequency, urgency, burning with urination, fever, and older adults may present with confusion and disorientation instead of urinary symptoms. Before reaching for medications, nurses should always ask, can this problem be prevented? Many urinary tract infections are preventable, especially in high-risk patients. First, recognize the patients at highest risk. These include women, older adults, children, patients with urinary catheters, and anyone with urinary obstruction, such as kidney stones or benign prostatic hyperplasia. As the nurse, your first task is to recognize these cues and identify which patients are most likely to develop an infection before symptoms even begin. There are several simple interventions that significantly reduce the risk of UTIs. Teach female patients to wipe from front to back after using the restroom. Encourage patients to drink plenty of water throughout the day unless fluid restrictions are prescribed. Unsweetened cranberry products may help reduce bacterial adherence in some patients. Catheter care is a huge NCLEX topic. Remember this NCLEX principle. The best way to prevent a catheter-associated urinary tract infection is to avoid unnecessary catheterization. If a catheter is required, maintain a closed, sterile drainage system. Keep the collection bag below bladder level. Never allow the drainage bag to rest on the floor. Perform routine perineal hygiene and remove the catheter as soon as it is no longer medically necessary. When caring for your patients, always ask yourself, is this catheter still indicated? And now, a quick clinical judgment challenge. A nurse is caring for 4 hospitalized patients. Which patient should the nurse identify as being at the highest risk for developing a catheter-associated urinary tract infection? A 32-year-old with an indwelling urinary catheter that was inserted this morning during surgery. B, a 68-year-old with an indwelling urinary catheter that has remained in place for 7 days because the patient is incontinent. C, a 55-year-old using a bedside urinal every 4 hours. D, a 47-year-old performing intermittent self-catheterization using sterile technique. You can pause the video and take a moment to think. And the correct answer is B. The nurse should analyze whether the catheter remains clinically indicated. Urinary incontinence alone is not an appropriate indication for a long-term indwelling urinary catheter. Let's see why other patients who also have a catheter are at lower risk than option B. For the first patient, the catheter was inserted today for a surgical indication and has not been in place long enough to pose the same level of infection risk. In option C, using a bedside urinal does not carry the same infection risk as an indwelling urinary catheter. And in option D, intermittent catheterization, when performed using appropriate technique, has a lower risk of infection than an indwelling catheter. Here is an NCLEX clinical judgment tip. When you see an indwelling urinary catheter, ask yourself, why does this patient have a catheter? Is the catheter still medically necessary? And if it isn't, take action and advocate for removing the catheter as soon as it is no longer indicated. So, how can we help our patients with urinary infections pharmacologically? First up is fosfomycin. Fosfomycin is a powerful anti-infective. Whenever you see this drug on the NCLEX, I want you to immediately think UTI. It works by interfering with the cell wall formation of bacteria. Administer it orally, ideally with food, to minimize gastrointestinal upset. It's effective for acute, uncomplicated infections. Fosfomycin is not recommended for children younger than 12 years of age. Now let's talk about adverse effects. Just like with most antibiotics, nausea, vomiting, and diarrhea are certainly common. It can be taken with food if it causes stomach upset. Some patients may experience bladder irritation or dysuria. At first, that might sound confusing because those are also symptoms of a UTI. This is where your nursing judgment comes in. Analyze the cues. Is the patient's discomfort gradually improving as the infection resolves, or are the symptoms becoming worse after starting the medication? Your ongoing assessment helps determine whether the treatment is working or whether the provider should be notified. Female patients may also report vaginitis, including itching of the genital area. You'll also want to monitor for blood dyscrasias, skin itching or hives, dizziness, nervousness, and confusion, especially in older adults who may be more sensitive to these effects and be more at risk of falls. Finally, before administering fosfomycin, always review the patient's medication list. It can interact with estrogen-containing medications and digoxin, so those drugs should immediately catch your attention during medication reconciliation. So if I had to summarize fosfomycin in one sentence, it would be this: recognize the cues of an uncomplicated UTI, verify that the patient is at least 12 years old, monitor for GI upset, bladder irritation, dysuria, itching, and dizziness, and always assess for potential drug interactions before administering the medication. And now a practice test question. A nurse is caring for a 79-year-old patient receiving fosfomycin for a urinary tract infection. Which assessment finding requires immediate follow-up? A. Mild diarrhea after meals. B. Headache. C. New onset confusion and disorientation. D. Vaginal itching. Take a moment to think. And the answer is C. Older adults often develop confusion from worsening UTI or adverse effects. Acute changes in mental status may indicate progression to serious infection. They should always be evaluated and should never be dismissed as normal aging. Now let's switch gears and talk about oxybutynin, also known by the brand name Ditropan. Whenever you see oxybutynin on the NCLEX, I want you to immediately think overactive bladder. This medication relaxes the smooth muscle of the bladder and blocks the effects of acetylcholine, which helps reduce bladder spasms, urgency, frequency, and episodes of urinary incontinence. In other words, it tells the bladder, relax, you don't have to empty every 5 minutes. Now, before we give this medication, let's think like a nurse. Why is this patient receiving this medication? Do they have symptoms of an overactive bladder? Are they constantly rushing to the bathroom? Do they have bladder spasms? If the medication matches the patient's symptoms, you're on the right track. Next, let's analyze the cues. This is where the NCLEX likes to challenge students. Since it is an anticholinergic, you have to ask yourself, who should not receive this medication? If your patient has glaucoma, myasthenia gravis, a urinary obstruction, or a GI obstruction, this medication can actually make those conditions worse. So before giving the drug, stop and think, is there anything in this patient's history that makes this medication unsafe? Now let's talk about the adverse effects. Since this medication blocks acetylcholine, it blocks the rest digest effect. So everything starts to dry up. Your patient may complain of dry mouth, blurred vision, constipation, urinary hesitancy, and decreased sweating. They may also develop tachycardia because blocking the parasympathetic nervous system allows the heart rate to increase. Some patients also report nausea or nervousness. Here's a challenge question. If this medication decreases sweating, what problem could that create? Your patient is at a much higher risk for heat exhaustion or heat stroke, especially during the summer or if they're working outside. That's why patient education is so important. Tell your patients to stay well hydrated, avoid becoming overheated, and recognize the signs of heat-related illness. Now let's apply some clinical judgment. Suppose your patient tells you, ever since I started this medication, I'm having trouble starting my urine stream. Should you refer your patient to a urologist? No, that's actually an expected anticholinergic effect. But here's where you need to evaluate the outcome. If the patient progresses from urinary hesitancy to complete urinary retention, that's no longer expected, and it should be reported to the provider. Another thing to remember is that oxybutynin doesn't work well with other anticholinergic medications because combining them increases the risk of anticholinergic side effects. It can also decrease the effectiveness of medications such as haloperidol and phenothiazines, so always review the patient's medication list before administering it. So, if I stopped you in clinical tomorrow and asked, "Tell me the most important thing about oxybutynin," I'd want you to say this: recognize the cues of an overactive bladder, analyze whether the patient has conditions like glaucoma or urinary obstruction that make the drug unsafe, monitor closely for anticholinergic side effects, teach patients how to prevent heat-related illness, and evaluate whether the medication is improving bladder control without causing urinary retention. If you can think through those steps, you're thinking exactly like the Next Generation NCLEX wants you to think. Here is our next clinical judgment challenge. A 72-year-old patient started taking oxybutynin 1 week ago for overactive bladder. During a follow-up visit in July, the patient says, "Yesterday I was gardening for about an hour, and I suddenly became very dizzy and felt like I was going to pass out. I had to go inside because I felt extremely hot." Which nursing response is most appropriate? A. This is a common effect of aging. Just try to work outside for shorter periods. B. You should avoid becoming overheated, drink plenty of fluids, and take frequent breaks because this medication decreases sweating. C. Your dose is probably too high. Stop taking the medication until you see your provider. D. If you feel hot, you should stand up slowly from a sitting position and make sure to dangle your legs before standing. You can pause the video and take a moment to think, and the correct answer is B. The appropriate nursing action is to teach the patient to avoid prolonged exposure to hot environments, stay well hydrated, wear lightweight clothing, and take frequent breaks during outdoor activities. Our next medication is Phenazopyridine. It is available over the counter, and you may know it by the brand name Azo. Phenazopyridine is not an antibiotic. It works like a topical pain reliever for the lining of the urinary tract. Think of it as putting a numbing medicine on a sore throat. But in this case, it's helping relieve the burning, urgency, frequency, and discomfort caused by a urinary tract infection or irritation after a urinary procedure. So before giving this medication, let's think like a nurse. Ask yourself, why is this patient receiving phenazopyridine? Is the patient complaining of painful urination? Burning? Constant urgency? If those symptoms are causing significant discomfort, this medication can provide relief while the antibiotic treats the actual infection. One of the biggest mistakes patients make is thinking that because the symptoms improve, the infection must be gone. That's not true. The pain may improve, but the bacteria are still there unless the patient is taking an appropriate antibiotic. So if you see phenazopyridine prescribed by itself for a bacterial UTI, that should make you stop and think. Now let's talk about the side effects, because there are a few that show up on the test questions over and over again. The first one is easy to remember. This medication turns the urine a bright reddish-orange color. Don't panic when you see it, and don't let your patient panic either. This is completely expected and harmless. It can even stain clothing and soft contact lenses, so patients should know about that before starting the medication. Some patients also experience stomach upset, headache, or a rash. Those are fairly common and usually not serious. However, use caution in patients with severe kidney or liver disease because this medication can cause renal and hepatic toxicity. Here's another NCLEX pearl that students miss all the time. Phenazopyridine should not be used for more than 2 days when treating a UTI. Why? Because after 2 days, it really isn't providing any additional benefit, and prolonged use may delay recognizing whether the antibiotic is actually working. Remember, this medication is only masking the symptoms. It is not treating the infection itself. Let's apply some clinical judgment. A 24-year-old patient was diagnosed with an uncomplicated urinary tract infection. The provider prescribed fosfomycin and phenazopyridine. 2 days later, the patient calls the nurse and says, "My burning is much better, but my urine is bright orange. I think something is wrong, so I stopped taking both of my medications this morning." Which nursing response is most appropriate? A. Orange urine is an expected effect of phenazopyridine, but you should continue taking your antibiotic exactly as prescribed until it is finished. B. Since your burning has improved, you can stop both medications. C. These medications are nephrotoxic. Orange urine means your kidneys may be damaged, so you should stop both medications immediately. D. Take the phenazopyridine until your urine returns to its normal color, even if that takes more than a week. Take a moment to think, and the answer is A. The orange urine is caused by phenazopyridine and is an expected harmless side effect. However, the antibiotic is what treats the bacterial infection. Stopping the antibiotic early increases the risk of treatment failure and bacterial resistance. So if I stopped you in clinical tomorrow and asked you to write the most important thing about phenazopyridine, I'd want you to write this. Phenazopyridine relieves urinary pain but does not treat the infection. Educate patients that orange urine is expected. Avoid using it for longer than 2 days, and always make sure an appropriate antibiotic is treating the underlying UTI. All right, let's move on to Pentosan. Whenever you see Pentosan on the exam, I want you to immediately think risk of bleeding. I'll tell you why in a moment. It is usually given for interstitial cystitis. Interstitial cystitis is different from a urinary tract infection. There are no bacteria involved. Instead, it's a chronic inflammatory condition of the bladder that causes bladder pain, urinary urgency, frequency, and pelvic discomfort. Patients tell you they feel like they have a UTI over and over again, but every urine culture comes back negative. So, before giving this medication, let's think like a nurse. Why is this patient receiving it? Are they experiencing chronic bladder pain? Negative urine cultures despite ongoing symptoms? If those clues fit together, Pentosan may be the appropriate medication. Pentosan works by coating the bladder wall and creating a protective barrier between the bladder lining and the irritating substances found in urine. Now here's the part I really want you to remember. Pentosan behaves a lot like heparin. In fact, it is a close cousin of heparin. So when you see Pentosan, immediately start thinking about bleeding. That means before giving this medication, you are looking for bruising, blood in the urine, black stools, bleeding gums, a falling blood pressure, or a decreasing hemoglobin and hematocrit. Those are all important clinical cues that patient may be bleeding. Another question you should always ask yourself is, what other medications is this patient taking? If you notice aspirin, ibuprofen, warfarin, or any other anticoagulant or NSAID on the medication list, a little alarm bell should go off in your head. Combining these medications with Pentosan significantly increases the patient's risk of bleeding. Are you ready for the next NCLEX clinical judgment challenge? Here it is. A 58-year-old patient with interstitial cystitis has been taking Pentosan for the past month. During today's clinic visit, the nurse reviews the following assessment findings. Blood pressure, 94/58. Heart rate is 112 beats per minute. Reports increasing fatigue over the past week. New bruises on both arms that the patient cannot explain. States, I've also noticed my stools have been black for the last 2 days. Current medications include ibuprofen as needed for arthritis pain. Which nursing action is the priority? A. Instruct the patient to increase dietary fiber because black stools may indicate constipation. B. Administer today's dose of Pentosan and reassess the bruising at the next visit. C. hold the Pentosan and notify the healthcare provider immediately. D. Recommend taking the Pentosan with food to reduce gastrointestinal irritation. Take a moment to think. The correct answer here is C. Let's think through this exactly like the Next Generation NCLEX wants you to. First, recognize the cues. This patient has hypotension, tachycardia, unexplained bruising, black tarry stools, fatigue, and is taking ibuprofen in addition to Pentosan. Next, analyze the cues. Pentosan has heparin-like anticoagulant effects, and ibuprofen further increases the risk of bleeding. Black tarry stools suggest a possible gastrointestinal bleed, while the low blood pressure and elevated heart rate may indicate blood loss. Now prioritize the hypothesis. The priority problem is active bleeding, not gastrointestinal irritation or constipation. Next, take action. The nurse should hold the Pentosan, notify the healthcare provider immediately, and anticipate additional assessment such as checking a hemoglobin, hematocrit, and stool for occult blood. Finally, evaluate outcomes. The desired outcome is prompt identification and treatment of the bleeding while preventing further blood loss. Now here's what you need to remember. Every medication that you administer follows the same nursing process. First, assess and recognize the cues. Why is the patient receiving this medication? Then, analyze the cues. Is this medication appropriate for this patient? Are there contraindications? Are there important laboratory values, assessments, or medication interactions to consider? Next, take action. Administer the medication safely. Teach the patient what to expect and monitor for adverse effects. Finally, evaluate the outcomes. Is the medication doing what you expected? Is the patient improving, or are they developing complications that require intervention? And remember, after you read the information about any drug or any disorder you are studying in nursing school, pause and ask yourself two things. What does this mean for my patient? And what does this mean for me as the nurse? Those two questions will help you move beyond memorizing facts and start thinking clinically. Because every correct answer on the NCLEX is rooted in patient safety and nursing action. Now let's finish with one final challenge. A nurse in an ambulatory care clinic receives 4 telephone messages. Which patient should the nurse contact first? A 23-year-old taking Fosfomycin for an uncomplicated urinary tract infection says, "I finished my dose 2 days ago. My burning with urination is gone, but today I developed a fever of 102 degrees Fahrenheit, 38.9 degrees Celsius, and pain in my right flank." B. A 74-year-old taking Oxybutynin for overactive bladder says, "I haven't urinated since yesterday afternoon, and my lower abdomen feels full and painful." C. A 40-year-old taking Phenazopyridine for urinary discomfort says, "My urine is orange, but now the whites of my eyes and my skin look yellow." D. A 59-year-old taking Pentosan for interstitial cystitis says, "I've noticed bleeding from my gums when I brush my teeth, but it stops after a minute." Pause and think for a few moments. Let's use our clinical judgment here. First, recognize and analyze the cues. Every one of these patients has findings that require follow-up. In option A, our patient's UTI symptoms initially improved, but now they have a high fever and flank pain, suggesting the infection may have progressed to acute pyelonephritis. This requires prompt evaluation and treatment. In option B, the patient taking Oxybutynin has acute urinary retention, demonstrated by an inability to void for many hours along with a distended, painful bladder. Urinary retention is a serious adverse effect of anticholinergic medications and can rapidly lead to bladder overdistension, severe pain, kidney injury, bladder rupture, and infection. This patient requires immediate assessment and intervention. In option C, orange urine is expected with Phenazopyridine, but yellowing of the skin and sclera suggests possible hepatic toxicity, a rare but serious adverse effect. This patient needs prompt evaluation, but the patient with complete urinary retention in option B is still at greater immediate risk. In option D, bleeding gums in a patient taking Pentosan are concerning because of the drug's heparin-like effects. However, the bleeding is minor, self-limited, and there are no signs of hemodynamic instability or major hemorrhage. So why is B the priority? The nurse should prioritize hypotheses by asking, which patient is experiencing a complication that could rapidly worsen if I don't intervene immediately? A patient who cannot urinate and has a painful distended bladder is experiencing acute urinary retention, a complication that requires immediate assessment and intervention to prevent further injury. So choose the patient with the most urgent threat to physiologic function. If you can recognize the cues, analyze what they mean, and identify the patient whose condition is most life-threatening, you'll be thinking exactly like the Next Generation NCLEX expects. Until next time, keep studying, keep caring, and keep getting it right every time.